Good evening, ladies and gentlemen, and welcome to Battling and Beating Cancer. We're in the middle, or actually towards the end of summer. It's been a beautiful summer in Chicago. One of the two baseball teams is still in the race. And if cancer were, if in baseball we talk about 5 tool players. And in cancer, here at Battling and Beating Cancer in the Chicago Blood Cancer Foundation, we really talk about the 5 tools of curing cancer and keeping cancer under control. The first one, of course, is prevention. The second one is prompt diagnosis, and that's related to awareness. Because if you're aware of signs and symptoms, you seek out treatment, you get diagnosed early, and the earlier you get diagnosed, no matter what the form of cancer, the better your chances are. The third tool, of course, is education, because an educated patient, a patient that understands his or her disease and the treatments, is a patient that's going to do better mentally, reduce some of the stress with the process, but also it translates into better results. The next, of course, important tool is getting the best treaters and the best treatments you possibly can, because that translates into optimizing your results. And finally, research, because research is really the tool that is going to be the ticket to all of our long-term survival, because that's what results in better treatments, better chemotherapies that are more efficient in attacking and defeating cancers, less toxic treatments, because so many patients suffer side effects and even die because of the side effects of treatments. And so it's that research investment that all of us make and all of us can participate in, and it's something that all of us can do, and we don't have to be doctors to make a positive difference in people's lives. And those are some of the things that we emphasize. I, of course, am Scott Seaman, along with the beautiful Charlene McMann. We are co-founders of the Chicago Blood Cancer Foundation. Charlene, of course, is a Jefferson Award winner and former first prize winner of Chicago Woman of the Year, and largely because of all the things that she does to help people who are battling cancer. And on our program, we invite you to call in at 312-738-1060 to talk. And boy, do we have a special show for you tonight, because when you talk about getting the best treaters, and when you talk about having cogent research done that makes a difference, you're looking at individuals like our guest tonight, Dr. Seth Corey, who is one of the best physicians and best researchers in the area of pediatric hematology oncology. In other words, children who are battling blood cancer, leukemias, lymphomas. And so get online if you have any questions. Charlene is going to be interviewing Dr. Corey in just a moment. I do want to talk for a minute about our Out for Blood ride, because it's almost here. We're less than 3 weeks away. On Sunday, September 12th, people are going to be coming out in force, getting on their bikes and pedaling to cure lymphoma, leukemia, and myeloma at the North Shore Century Bike Ride in Evanston. And those who are really good riders can go 100 miles, go all the way to Kenosha and back. Those who aren't can go a mile or 20 miles or 50 miles, however far you want to go. And there's no excuse for not participating, because even if you're like me and you're not a bike rider, you can do something like form a virtual vampire team online and help raise money to benefit everybody with blood cancer, or just donate. So there's something that everybody can do. And if you go to www.chicagobloodcancer.org or call 888-792-9992. We will give you all of the information that you need. And at chicagobloodcancer.org, you'll look at the icon in the upper right-hand part of the home page that looks just like the one you see on your screen. You can click on there, get all the information for the bike ride, register online, donate, whatever you need to do. But please participate in this bike ride. Very briefly, because we want to get to Dr. Corey, we want to do our segment on keys for curing cancer. And tonight the focus is on children, because here I was about 12 years ago going through chemotherapy, feeling, woe is me, the world is coming down, I am the only one in the world with cancer, isn't this horrible? And then when we look up, and Charlene and I would see a child or a little baby with a chemo infusion, or getting ready for treatment, that's just the saddest thing. And kids with cancer are something that I don't think anybody with a heart could look at and not feel, boy, there's really something that we need to do to help these kids out. And if you want to make a dent into cancer, we've talked before about blood cancer really being the superhighway to curing cancer, because so many of the treatments and the advances in all forms of cancer have originated from lymphoma and leukemia research. The same is true with children. And for example, more children die of leukemia than any other form of cancer. And lymphoma is the third most common cancer in childhood. So nothing, I think, in terms of cancer impacts children more than blood cancer. And I have to tell you, you think that some of these little guys and gals who are going through this are really heroes, because they're braver than us adults. They have better spirit than all of us. They really go through all of this in some ways better than adults do, and they have that just wonderful spirit about them. And I think that motivates all of us to go forward. So anything that we could do to help kids as a country like America, we've got to do. And so I'm going to cut the segment a little bit short tonight so that Charlene can get to Dr. Corey, because he's going to have a lot of information about pediatric blood cancer to share with you tonight. Get online 738-1060.
Thank you, Scott. Really good. We wanted to just...
And I didn't call you beautiful at all.
No, you did. You did. He did. And I told him not to do that. So it's embarrassing.
That's another violation.
Don't do that. So I just want to talk a little bit about Chicago Blood Cancer Foundation. Is a 501(c) organization committed to curing lymphoma, leukemia, and myeloma. We say the blood cancer research is a superhighway to curing cancer because so many breakthroughs and treatments for cancer and other diseases have come from blood cancer research. We invite you to join us on the superhighway to curing cancer and contact us if you or someone has been impacted by cancer, blood cancer, or if you have any questions or you want information about our Out for Blood ride team. Call us at, again, 888-792-9992, or visit us at www.chicagobloodcancer.org. And now I want to introduce Dr. Seth Corey, who is the Director of Oncology Research, Co-Director of Hematology and Oncology Fellowship Program at Children's Memorial Hospital. He is an attending physician and board certified in hematology, oncology, and pediatrics. He is a professor of cancer biology and chemotherapy, professor of pediatrics, Northwestern University Feinberg School of Medicine. And welcome, Dr. Corey, to Battling and Beating Cancer.
Thank you, Charlene. Thank you for the opportunity.
Very nice to have you here tonight. First, I want to start it out and just ask you a little bit. I want to talk about leukemia first in children. And again, like Scott had said before, it's devastating when you go and you see a child just going through, prednisone, moon face, and their hair's all gone, and it's heartbreaking. So you're doing great work and working with children and stuff. But I wanted to start with a little so our viewers can kind of see and understand leukemia. What types of leukemia are most common in children?
The most common type of leukemia in children is acute lymphoblastic leukemia, known as ALL. The second most common would be acute myeloid leukemia, but by far the most common is ALL.
Mm-hmm. And what, and again, because we don't really know a lot about what causes cancer and different, they're saying environmental, they may say chemicals, additives that we're eating in our food, different things that are being exposed to in the environment. Do we know what causes leukemia in children?
Unfortunately not. Most cases of leukemia, regardless of the type, there's no cause that's been identified. There are things that we can reassure the parents that they didn't do or did do that affected the outcome of leukemia. But the possibilities are that there's a virus, that they may be exposed to something in the environment, they may be eating something, but the epidemiological studies have failed to really point out a specific cause. Only in rare cases is there a genetic basis for that. And that is in cases where these are rare syndromes known as Fanconi anemia or Bloom syndrome, ataxia telangiectasia, Down syndrome. The vast preponderance of children diagnosed with leukemia, we don't know what causes it. But it's okay because we can treat it.
Right.
And at least we can reassure the parents that there was nothing that they did or didn't do that affected the occurrence.
Okay. And again, you know, parents, they see their children having colds and different things or fevers, and we kind of want to, you know, it's kind of hard to say because sometimes, you know, I know leukemia, you run colds, you can't get rid of colds and fevers, but what signs and symptoms would parents be aware of if they had any indication that they possibly had some form of leukemia? Or when would they come to you, basically?
Well, keep in mind that the signs or symptoms that a child has who's later diagnosed with leukemia are pretty non-specific signs and symptoms that any child would have. So any child could have a fever, any child might have poor appetite, any child might have a limp. And so the odds are that your child, if your child has a fever or is somewhat listless, that it's something that's transient and will go away. To put things into perspective, there's about 3,000 cases of childhood leukemia diagnosed in the United States every year. So that's basically 1 in 25,000. So having said that, remember that if your child has a fever or a limp, the odds are your child is fine and is just getting over an illness. So to address the question, kids come to us because the mom has noticed that their activity hasn't been that great, their appetite is off, they may have a limp that lasts longer than the mom and their general pediatrician might think is appropriate. They have a fever that doesn't seem to respond to antibiotics. So it's pretty general, non-specific signs.
And so, in other words, and again, they would go to their normal pediatrician and then get referred to you, or is it?
If your child has a fever or has got poor appetite, the overwhelming odds is that your child is fine and is just getting over an infection.
Right.
So that's important not to create any sort of unnecessary anxiety. But if your child has a fever that persists, that you take your child to your pediatrician, tries several courses of antibiotics, your child doesn't look well to you, you might actually feel the tummy getting a little bit larger if it's a small kid, or feel lymph nodes in the neck that are enlarged and not painful, then you should ask your pediatrician to maybe give a closer look. But again, this is uncommon.
And again, it's something that's persistent and keeps going on and doesn't clear up and comes back or doesn't clear up. So it's something that has to be looked in a little more, except just a natural cold or something that children get.